Hi, everyone. This is Janet Hill at the Rock Island County Health Department. Thank you for joining us. It's 3:30 p.m. on January 26, 2021. Today, we have with us Nita Ludwig of the Rock Island County Health Department and Edward Rivers of the Scott County Health Department. They will be speaking about vaccine rollout. If you have any questions, as always, please put them into the chat, and Brooke Barnes of the Scott County Health Department will be the moderator. Nita, let's start off with some Rock Island County numbers, please.
Hi, good afternoon. Today in Rock Island County, we have 25 new COVID-19 cases, and that brings our total to date to 12,036 cases. We are reporting one additional death today of a woman in her 60s who had been hospitalized, and we do send our deepest condolences to the family and loved ones of that individual. Right now, there are 36 people hospitalized in Rock Island County.
In Scott County, the Iowa Department of Public Health reports 15,927 cases, and our deaths remain at 172.
Winter in northwestern Illinois and eastern Iowa brings all sorts of challenges, and the pandemic compounds the trouble. Our third COVID-19 mass vaccination clinic fell victim to the winter this week, actually today. This vaccination clinic was scheduled for today and had to be postponed because of this week's snowstorm. All 600 people who had registered for this week's clinic will be transferred automatically to Tuesday, February 2nd at the same time slot, and they will receive their first dose of the Moderna vaccine. We decided to postpone on Monday because we were concerned about the safety of our residents who registered for the clinic and our staff members working it. No vaccine doses will go to waste because we had to postpone this clinic. Weather permitting, we will continue to have clinics at the Greater Quad City Auto Auction at 4015 78th Avenue in Milan, and clinic time slots are 9 a.m. to 2 p.m. and must be reserved in advance. As always, all clinics are dependent on weather and vaccine supply for each week. Registration slots become available at 10 a.m. on Fridays on our Facebook page and on our website, richd.org. We are using Sign Up Genius for the time slots. You don't need to sign up for an account with Sign Up Genius. Just click on an open slot, put your name and email address in, and then click Submit. Last week, the slots filled up in about 4 minutes. And so no new slots will be available this Friday because of this week's postponement due to weather. Our team is also finalizing in our system to make sure people who received their first dose with us can get a booster shot. Some weeks, the clinic will be only for people getting that second dose. But most weeks, they will be able to split out first and second doses in the same Tuesday clinic. The amount for each group will, again, depend on the supply and the number of people due for their second dose. The CDC said last week that people have up to 42 days after their first dose to get the second dose, which is fortunate because it allows us at least some protection. It allows us to give at least some protection to more people while not hurting the progress of the people who received their first dose. Our weekly vaccination clinics are not our only way that you can get vaccine. We are relying on our partners to help us vaccinate our county of 143,000 people. We received wonderful news today from the Illinois Department of Public Health, and that is that Hy-Vee stores and pharmacies will now be offering COVID-19 vaccinations. And those are the stores in Milan, 2 in Moline, Rock Island, and Silver. And they will start vaccinating tomorrow on Wednesday. And their hours are Monday through Friday, 7 a.m. to 7 p.m., and Saturday, 9 a.m. to 5 p.m. Eligible residents in Phase 1A and Phase 1B can register at www.hy-v.com. Right now, Hy-Vee has the Moderna vaccine, and they said that they would give either the first or second dose. So it does not matter if you did not get the first dose with them. They will give the second. The state of Illinois is also collaborating with Walgreens and Jewel Osco to provide COVID-19 vaccinations. In Rock Island County, Walgreens on Avenue of the Cities in Moline and Jewel Osco in Moline, East Moline, and Silvis are also participating. Jewel Osco corporate has said that they cannot give the second dose to people unless they got their first dose with Jewel Osco. I have contacted the corporate office and we are working to try to change that. But Hy-Vee has said that they will give first or second doses. The health department is also working closely with community healthcare, Unity Point, and Genesis to vaccinate groups in phases 1B. Community healthcare is asking those 65 and older to email COVID vaccines at chcqca.org to inquire about scheduling a time to receive vaccines. We understand that everyone is eager to receive both doses as quickly as possible so that we can all get back to normal life. All of this will take time and patience. We are thrilled to bring more partners in to help us vaccinate our community. The bottom line, we still have more people who want the vaccine than we have doses. But supply and the number of ways to be vaccinated are growing. Your turn will come. Even after you're vaccinated, please continue to wear your mask, watch your distance, and wash your hands. These public health precautions will be with us for months to come. Thank you.
We're grateful for our community's interest in the COVID-19 vaccine. We receive many questions every day inquiring when public clinics will begin. The demand for vaccine remains very high, while the supply of COVID vaccine in Scott County is very limited, and we don't expect this to change in the near future. We recognize that people are impatient to learn the details about our upcoming clinics. While we've been working through phase 1A, we've been developing a plan to manage this issue to the greatest benefit of the community as phase 1B begins. Next week, the week of February 1st, we will begin vaccinating people who are identified as qualifying in phase 1B. These include people 65 years of age and older, and pre-kindergarten to grade 12 staff, early childhood educators, child care workers, and first responders, police, fire, and DHS, in Tier 1 of Phase 1B. We need to emphasize that not all members of a priority group or a tier will be able to receive a vaccine immediately. The clinics for people aged 65 and older will be the first public clinics taking place in Scott County. We'll be announcing details later this week. The clinic dates, times, internet links, and phone numbers for appointment scheduling will be listed on our website, Facebook page, in local media broadcasts and newspapers. Residents can register to receive email updates for vaccination clinic dates and updates to our website. The email listserv link can be found on the front page of our website. Clinics for Phase 1B Tier 1 will also begin next week. These clinics will be scheduled differently and will not be announced. We will be reaching out to local schools, first responder agencies, and the Department of Human Services to identify those people qualifying in Tier 1 group. People qualifying in this group will not need to reach out to our department to get an appointment. They will be connected to an appointment scheduling through their employer. Our department will continue to share updates in a variety of places. As I said earlier, our website, Facebook page, local media broadcasts, and newspapers. As more vaccine comes into the community, these updates will continue to tell people what they need to do. As we move into Phase 1B next week, People in other priority groups and the general public are asked to continue watching for updates that tells them what steps to take. For many in our community, there's nothing they need to do at this time. We thank you for your patience as we navigate this exciting yet challenging process.
Thank you, Ed and Nita. Appreciate that. We'll go to the questions. Please type in any if there are some right now. I do have one for both of you, so I think I'll let you each speak to this. Wondering if you expect to see an increase in available doses. What are you guys hearing? Nita, we can start with you.
Sure. Well, we are seeing, an increase in doses in our county with the addition of Hy-Vee starting vaccinations tomorrow. So that's great to see. We have yet to see our allocation amounts go up, but I should see that allocation for our county tomorrow sometime. So we certainly hope that happens. We know that in the news they have been saying that vaccine production is increasing, so we are hoping that does trickle down to our county.
We'd love to know when we're going to get more vaccine in Scott County. We've been advised by the Iowa Department of Public Health to expect the same amount of vaccine we've been receiving weekly for the near future. It all depends on the federal government's apportionment of the vaccine and the ability of the companies that produce the vaccine to scale up their efforts.
Thank you. Another question for both of you. We've received several calls from older adults overwhelmed or confused about how to get vaccinated. Any advice for some of the older folks in both sides of the community? Ed, do you want to give anything for Scott County?
Yes, we're looking at partnering with agencies within the community that deal with the elderly people in our community on a daily basis to assist the 65 and older crowd in understanding how to become, how to get appointments and how to sign up for appointments and facilitating that. That information will be available soon.
I
Go
would
ahead.
just add, this has been very challenging for Rock Island County as well. Last week's clinic that we had drive-in, we did have over 90% of the folks that came through that clinic were 65 and older. So we know that they did make it out to that one, which we're very appreciative of. This week when we went to the Sign Up Genius link to sign up for appointments, we did hear that some people were having trouble navigating that or they didn't have internet. We are working on other methods to try to help people do that. And again, we hope with some of our other partners, Community Healthcare, Jewel Osco, and Hy-Vee now coming on board, that there will be more options and opportunities for everyone to get an appointment if they so choose that way.
Are we seeing any adverse reactions to vaccine at our sites? I know that you aren't there as vaccinators, but perhaps you've heard any feedback from your staff. Nita?
Sure. So we have had very few reactions, actually. We've had our staff vaccinated now, and of course, 2 of our large drive-through clinics. We have had a few mild reactions, such as metallic taste and a little bit of lightheadedness. We've had some people that we've watched longer than 15 minutes for those reasons, but no one that has had to be transported to a hospital or anything like that. So that's very good news.
It's much the same in Scott County. There have been no significant reactions, only those mild reactions that have been noted throughout the process. Some discomfort in the injection site, maybe some fatigue or muscle aches, but nothing significant at all.
Nita, there's a question here. Would you clarify the CDC guidelines again that you mentioned and the timeline between the 2 doses, just so people don't panic if they don't get it within 20 days?
Sure. So for the Pfizer vaccine, the first recommendation is to try to get it 21 days later. And for Moderna, it's 28 days later. However, the CDC has just recently come out and said that you really have 42 days after the first vaccination to get the second. And even if you don't get it in that amount of time, which we certainly are striving to do for people, then it's just recommended to get it at your first opportunity after that.
Great. Will the health departments be keeping track of other demographics with the vaccine? For example, wouldn't it be good to know if the vaccine is reaching poor people or how many vaccines are going to different ethnic groups? Ed, I don't know. I know Scott County is working on a new system. If you've been involved in that, it's my understanding that those are all questions that I believe will be on there.
Yes, and there's some demographic information that goes to the immunization registry as a part of that process. We will be following closely who is getting the vaccine. Up to this point, it's been only medical providers, so we've had time to prepare for that.
Go ahead, Nita. Do you have some information on that as well?
Sure, and I will just note, as Ed did, that to this point we've done mostly healthcare professionals in phase 1A, and then a good chunk, like I said, of our last clinic was people over the age of 65. We also have this immunization registry in Illinois, so we are entering that data. And I'm not sure at this point in time the different fields that the Illinois Department of Public Health might be keeping track of. So that'll be something that we look at as we move forward here.
Okay, Janet did just type in the link to the Hy-Vee ability to get vaccine appointments in Illinois, in Rock Island County. So that is on there as well to grab. Seeing no additional questions, we'll go ahead and conclude today's briefing. We will be posting these on our website as well as our social media page, so please find it there. We do intend to come back and talk with you again on Thursday afternoon at 3:30. So if we have anything between now and then, we'll be sure to share it with you via email. Thank you everybody again for joining us today, and we look forward to talking with you later this week.
Thank you.